With cancer in the mind's eye, we see the person, whole and healthy, fighting an invasion of malignant cells. With alcoholism, there's the person and there's the bottle. They're separate and at odds, or bound in a dance to the death, but still distinct. Schizophrenia wraps itself so tightly around the personality of the sufferer that the person and the illness look like one. We cannot see the partner in this dance.
Master's degree in psychology, and I've been a licensed psychologist for about 30 years, a little more perhaps, and I'm currently the clinical director at Lee Carlson Center. I think the thing that's important for people to understand about mental illness is that it is an illness, and that people are symptomatic because of that illness that may involve lots of different factors.
I'm DJ Moser, and I have have a diagnosis of depression, treatment-resistant and recurrent. I've been struggling with the depression since about 1996, and I've had many hospitalizations. I've gone through many treatments.
I think that this is an important topic because, in spite of all of the strides that have been made in the mental health field, I think stigma is still there and really impacts people.
My name's Cynthia Bleasy, and I'm on the mental wellness campaign for Anoka County, and I have been diagnosed with many psychiatric issues, and I'm disabled, but I get to give back, and one of the ways I give back is by working on the campaign, and it's a great way to feel like I'm contributing to something.
I'm Lynette Sickler. I'm a mental health therapist and a licensed alcohol and drug counselor. The mental wellness campaign of Anoka County formed about 10 to 12 years ago, and it was following a survey that the Wilder Foundation did in Anoka County to look at what is the stigma, or is there a stigma about mental illness in the county, and it was pretty high. The campaign was formed to help erase that stigma. Our goal is to go out and do education, presentations for people to better understand mental illness. And our message is that mental wellness is as important as physical wellness.
You know, the mission is to erase the stigma, and that's the one thing I am so grateful of, is that I don't have to be ashamed of being mentally ill. You know, I live with mental illness. It's something that I learned to do, something the hospital helped me do, was learn to live instead of just exist.
I'm Lila Pagels, and I coordinate the Faith Community Nurse Program out of Mercy and Unity Hospitals, which is part of Allina Health. And we work with around 35 congregations and parish nurses in the North Metro region. In our work, we deal with many people with depression, bipolar, borderline personalities, people or families that are dealing with, that are survivors of suicide, for instance. It's just one of those things that, like physical dis-ease, there's a lot of mental dis-ease, but there's more stigma to the mental piece of it. And so a lot of our work has to do with trying to dispel the myths and some of the assumptions that are out there in people's minds about mental illness, because it's just as important as our physical well-being and our spiritual well-being.
I think with people with recurrent problems, that you're always in a phase of recovery. And I've been working my recovery since 1996. I still have times when I need extra help, but it's an ongoing process. And knowing that you're very vulnerable at these times, that you have people that will support you and use them.
Education and support are really keys there. And there are organizations in Minnesota that have support groups and will educate family members about what's happening as far as symptoms and what to expect.
You know, I think the best advice I would give other people is that learn, find out about the condition that your loved one has. If you can name it, and really increase your knowledge and awareness of what it's about. And whether that's going to a certain class or reading a book or connecting with a support group around that, because there are support groups for families of people dealing with lots of different kinds of issues.
My name is Mary Ellen, and I'm a professional interior designer since 2005. I have two sons that have had, well, one in particular has had significant impairment from depression and anxiety and panic attacks, which started when he was, well, now that I look back, I can see signs back when he was much younger, but it really kind of, blew up at the end of 8th grade. He's currently a senior in high school, and at that point we figured out that his symptoms were due to depression, and I asked him if he was suicidal, and he said yes, he was. And so we then started to seek therapy and medical assistance and so on, because that very day, because obviously I knew this wasn't something that we wanted to delay, or it wasn't going to go away on its own, so he needed some help.
We have a granddaughter who began having mental health issues, I believe, when she was 16, early when she turned 16, with depression. And she ended up with an eating disorder, which sort of went into more of a severe chronic depression, and she was in treatment day programs for many, many years.
Not too long after that, he was hospitalized for a week because his suicidal thoughts had gone from thoughts to making plans, and then spent the rest of the summer, 3 more weeks, doing a partial hospitalization program during the day. So he's really, really a fighter, and he has struggled, and it's been hard, but he's hanging in there, and we've seen quite a bit of progress. Although, there's always the ups and downs and the setbacks and the worries, but so he has been really fighting this for about 4 years now.
And she was eventually diagnosed with a borderline personality disorder, and along with that is anxiety issues. The depression still is there. She's seen, many providers, psychiatrists, counselors. Medications are always an issue with mental illness. They a lot of times take a long time to work, and then sometimes the side effects creep in, and you end up having to change medications. And so it's just quite a road to be on.
I'm Vanessa Olson, and I am an analyst at a global company. My son has Asperger's, he's high-functioning autism. It's been a challenge over the years, but he's a good boy and very intelligent. But the beginning years were very hard for all of us because he wasn't able to express his feelings the best, and certain things that were common sense didn't exactly always come normal to him or were common to him at all.
My name's Laura Flynn, and I'm an author and published a memoir about my experiences growing up with my mother, who suffers from schizophrenia and has for most of my life. It's a memoir about a childhood spent with my mother and the struggles of my family to deal with her illness and all of the repercussions it had on us.
All these years I've been doing this alone with my son, and it's been very hard with schools understanding being a young parent as well as having my son with disabilities. They just thought it was more, you need more structure, or he's just, has behavioral issues. And it took a lot of fighting to find out exactly what the problems were and to get him the help that he needed.
It's very hard to say exactly when I knew. As children don't have the language capacity really to fully understand mental illness. I think maybe until, it's different for every child, but for me, I don't think I really understood until I was probably about 7 or 8. And also it's hard to say exactly when my mother became ill, because my memories of her as a very young child is of a woman who was incredibly imaginative, loving, warm, really wonderful mother. But she also had a lot of rules, was stricter than many parents, began to regulate my sisters and I's behavior, and then so there was a time when I understood that she was certainly different or eccentric, and then there was another time when it felt like she was so difficult, hard, that I really felt she was bad. That was the only way I could understand her behavior.
And then I have another son who is a few years younger than him, that the first signs that I saw from him that there might be any difficulty with depression or anxiety was when he was in 3rd grade. His teacher contacted me and said that he would arrive at school in the morning, and then in front of the entire class he would put his head down on his desk and cry. So I brought him to a therapist at that time, and that really seemed to help and alleviate the symptoms, and he went back to his normal, cheerful self. And now, as a teenager, we're going through some more difficult times, and he's really struggling in school, and he is seeing a therapist. He's currently not on any medication. He's highly resistant to that. He's not wanting to see the therapist very frequently. He's not completely on board, but he's doing okay, but it's definitely impacted him and the rest of the family.
And it really wasn't until I was 10 years old and my dad sat me down and told me, your mother suffers from, at the time they said paranoid schizophrenia. And it was that explanation that helped me put words into the experience that I was having. Though I already knew that everything she saw and did wasn't real. I mean, she shared with me at length kind of the inner world that she was living in, and I knew even as a child that wasn't real, but I certainly didn't have the language to explain it.
As far as our family goes, I think our immediate family was, very supportive, and we didn't know a lot about the navigating of the health system around mental illness, but I know especially her dear parents learned a lot, about that. And as far as aunts and uncles and cousins, I think sometimes there still is some misunderstanding of what she goes through, because there's good times and there's bad times and good days and good weeks, and then times when she isn't so comfortable just being with other people, like at family gatherings, that type of thing.
Challenges with the family would involve, family gets together for birthday parties or Christmas or Thanksgiving, and there would be too many people for him, and he wouldn't understand how to share his emotions or his feelings, they would end up, I'd call them his meltdowns that he'd have, where he would completely turn down screaming and kicking and yelling out things that he wanted to be dead, and he wished he wasn't alive. He didn't know how to deal with his emotions that he was feeling, that anxiety that he was getting from all the people being around.
I have 2 other children that don't appear to be suffering from any mental illness. And I know one has said, well, you're always busy with so-and-so, or you had to be busy with so-and-so, because of course, as an ill child, they need more attention and they need more time. So there's just, being torn between, giving so much to the child that needs you and then having other family members and, your marriage to attend to. It's just difficult to balance it all and to feel like you're doing everybody justice.
I think we've learned that when she can be there, wonderful, and when she decides that she can't be there for whatever reason that day, that's the way it is.
And as much as my family is loving and caring, it's a lot for them. We all have kids around the same age. They didn't know how to respond to him, which caused him to be kind of a drought from them of really growing with him, because he has differences than they do, and they don't quite always understand it always of why he's behaving that way. And then it's bad too, because it makes me feel like I'm punishing him by putting him in a separate room and telling him just to stand there and play with his Game Boy or something. But I know I'm not punishing him. It's for his best. It's where he feels more comfortable on his own, and everybody else can get through the holidays. But it's still really hard for them to, you want your child to be with everybody else and you can't.
People don't really understand what this is all about. Even after I've cried and described and tried to explain what this means, what it means to be truly depressed, people think that they know. And I'm not trying to minimize other people's experiences or pain, but they think, they had a job loss and they were really down and just wanted to sleep, but then they bounced back, because then they finally got out of bed and looked for a job and then everything was fine. Well, they don't understand that maybe for some people, the depression is so deep and so dark that this is an illness that you can't just bounce back from because of incredible strength.
I find that when I get depressed, there doesn't seem to be much of a trigger. I'm not sure if it's chemical or what, but I just start going down and there's not much I can do about it.
Because of that misunderstanding, people will, and well-meaning people, well-intentioned people who I dearly love and appreciate their support, will say things like, just make him. Your son's having a panic attack in the parking lot at school, covered with hives, sobbing uncontrollably. Force him, just drag him into the school. Well, that doesn't help me. All that does is just add more stress, and it's not the solution, and people don't understand that it doesn't just work that way. This is not just a teenager that doesn't want to get out of bed because he'd rather sleep in and play video games. Or people will say things like, maybe you shouldn't coddle them so much, or maybe if you went and got a job, they would be more resilient, or your kids just need to go to school even if they don't feel well, or, and again, it's all well-meaning, but it's a very lonely place to be, because there is really nobody that understands.
I'm Sue Abderholden. I'm Executive Director of NAMI Minnesota, the National Alliance on Mental Illness. I would kind of caution people when they hear that someone has, a teenager or someone else living in their home to say, well, you should kick them out, you should do that. It's not as easy as it looks, because what will happen if your child has ever attempted suicide. You never want them to do that again. And so you are very careful about, pushing them in ways that aren't healthy as well.
If family could understand how incredibly exhausting it is to try to help a child with mental illness, and try to reduce the stress with the daily garbage that we all have to get done. You know, maybe if somebody would say, I'm bringing dinner over on Saturday night so you don't have to cook. I'm taking your healthy children out because you need to be home with the child that can't get out of bed.
Day-to-day chores, you know, dusting, vacuuming, folding laundry, cutting the grass, just those normal day-to-day things that everybody has to do, but on top of trying to remind your child 5 times, 10 times a day to do something and having to help him because I can't just let him do it on his own because he doesn't remember. It's nice if somebody could take that away from me or just even come over and cook dinner for the evening. You know, one less thing for me to do after working all day and coming home and dealing with the situations that had happened from school. To cook dinner on top of it sometimes can be a lot.
Any of those little things that would relieve the busy schedule of your day would be an incredible relief.
People give bad advice a lot, right? When you're, if you have a family member, they might say if they hear that you have a son or daughter who's maybe a teenager or the early 20s, it's just like, do tough love. Well, we wouldn't do tough love with someone maybe who had epilepsy who wasn't doing well, or a child who had cancer. These are real illnesses, and so tough love doesn't work.
Pull yourself up by the bootstraps. That's one of the worst. Or you can manage this when you're utterly down, and being judgmental, again, that it's in your power to change this, and that perhaps it's all in your head.
The suicidal thoughts are not a sign of weakness. They're not a sign of somebody that is morally bankrupt. They are a sign of somebody that has an illness. So if you have the stomach flu and you feel the urge to vomit, how would you feel if somebody said to you, quit it? You're feeling the urge to vomit because you're a weakling. Snap out of it. It's not that bad. It's a symptom. It's a symptom of the disease. And unless they've gone through it, or they know somebody who's gone through it, they don't understand that having frequent thoughts of death, or suicidal urges, or strong urges, or urges to cut themselves or do self-harm, they don't understand that this is part of the disease. It's a symptom of the disease. People think it's a weakness, and that is so infuriating to me, because after all that I've seen my son go through, especially, I can tell you that he's the strongest person that I know.
And I have to say, the other problem that almost every family I've met will say, and it's certainly happened in my own, is that the mental health system is not good about recognizing the importance of family and friends in recovery. If you're being discharged from the hospital for cancer, they tell you, have someone in the room. You're not going to remember everything. It's hard to hear it when you're leaving the hospital. Bring people in so that they can help you when you go home. If you're being discharged because you have a mental illness, there's often no one there. They say, well, you didn't sign a privacy release so that you can't be there. And families are really pushed out quite a bit. It's something that we're working on. But so then you have people who are even more isolated, and you get calls from the therapist saying they missed their appointment, and you want to say, well, if you had told me when it was, I could have made sure that the person got there. So that also makes it very difficult too, because you can't even know how to help your loved one, and you're not getting those supports from other people.
It's so intangible. We, I think our medicine and our culture, we do pretty good at dealing with things that we can see and touch and do treatment for, or do an x-ray, or a pill. And yeah, there is medicine, there are drugs for certain types of mental illness, but it's much more difficult to get the right combination than it is with someone with diabetes, for instance, where you check your blood sugar and you've got to take that much insulin and you'll be fine.
If you have somebody who's a friend with mental health issues, the best thing to do is don't judge and be supportive and just listen. You know, a lot of times I just need people to listen to me.
I think there is sometimes a tendency in looking at mental illness to think that, well, to see, you know, that's an other. Those are other people than us, you know, and also that I noticed as I was writing, people would ask things like, weren't there signs or symptoms? And there's this, seems to be this underlying idea that people who suffer from mental illness are marked from very early on. And I don't think that's accurate. I think it's something that can happen to any of us at any time in our life. And that saying that, you know, sort of wanting to identify they were strange always kind of idea is a way of protecting ourselves. But the truth is that we're all in this same set of circumstances. And I think breaking that down can actually help people to understand and sympathize and empathize more with the mentally ill, to understand that this could be your mother, this could be your child, this could be your husband or wife. These things can happen to anyone.